And today we're standing here to proclaim that we have gotten it right. And gotten it right for the residents of the city of New Orleans. Things just don't happen just because. It takes partners and people who are very intentional, who understand the need, and do what it takes to meet our people where they are. And that's why you see us assembled here this afternoon as a team. You're going to hear from many of the leaders who are present here this afternoon and who has just done everything possible to make this day possible, but to really make the Mobile Crisis Intervention Unit a reality again for the residents of the city of New Orleans. So today, as you see, I'm joined by members of the Orleans Parish Communications District, the New Orleans Health Department, the New Orleans Police Department, EMS, Homeland Security, the New Orleans City Council, and partners with our Resources for Human Development. Thank you so much. Thank you so very much for all that you've done to get us here. The mental health needs of our community has been something that we have known existed, and we have been very intentional again about putting resources where we know our community needs them the most. So while we're waiting and even pushing for additional resources at the federal level, even at the state level, we're putting resources that have come directly to this city through the federal government, through the American Rescue Plan dollars. We're putting them to work and into real action. But we started working on this collaboration in August of 2022. And we stood up a pilot program, particularly, and thank you so much, Dr. Avegno, thank you so much, New Orleans Police Department Superintendent Michelle Woodford, for the pilot really starting out in NOHD District 3, the 3rd district. And over that pilot period, we used real data to even demonstrate the need so that we knew that it made sense, but that we can make the plea and the call to action and to our partners, the New Orleans City Council, to approve the budget allocation that would make this possible. The data didn't lie. Again, meeting our people where they are. And as a result, we were able to start our program. And at the start of it, we called it the alternative dispatch through the pilot. And from that, we were able to jumpstart and kickstart on June 1st, what we're now launching, the Mobile Crisis Intervention Unit. That soft opening gave us a 2-week spread, again, to get our sea legs, get our wings. And every day we're just getting better, right? But we wanted to show the community, again, not just in words, but with real action, that when they called, that they would get the response that they needed. And as of today, we received 93 calls. We have seen our community step forward and believe in the program and demonstrate civic trust in us. And we've been able, again, to respond in real time. And responding to matters that do not involve a weapon and or violence. Now, we've had 4 calls thus far that we've had to redirect to the New Orleans Police Department, but that's what this is all about. Freeing up our officers, lifting the burden on the men and women who serve every single day to protect us, but providing the experts, the behavioral health experts, again, on the ground when we hear the need of our residents when they make that call. So I'm so excited to launch this program, the Mobile Crisis Intervention Unit. It is our hope that this will live on for the city of New Orleans, literally for generations to come. My council member, as I came up here, he said, Mayor, first time ever, this is history we're making. And we know that we should have had it long time. But right now is the best time, because the time is now as we know it. I have been working with my brother and sister mayors across this country relative to mental health services that our cities need. And the city of New Orleans, again, is stepping up, being that example. But Mayor Sheedy of Reno, Nevada, is now the president of the U.S. Conference of Mayors, and she's made mental health a top priority so that we can take our voices and elevate them to the federal level, and also plead at the federal level that resources need to continue to come directly to cities, because we're on the front lines and we're the ones accountable every day, again, by meeting our people where they are with the resources that they need. But we embarked upon a survey where 117 cities were surveyed on how they are responding to this challenge that we know is real. And the results show that in nearly all of the cities surveyed across 36 states, the demand for mental health services is not only on the rise, but it is something that we need to respond to collectively now more than ever. The city of New Orleans is doing that. But 88% of those respondents, my brother and sister mayors, said that they do not have adequate access to the mental health resources needed to address this crisis in their city. 97% said that requests for mental health services increased in their cities over the last 2 years. We know that COVID-19 hit us very hard. And to think that, oh, it's behind us and yet left us unharmed is just not a fact at all. We're harmed, all of us. And so this city is putting her resources where they're needed the most. And you're going to hear from this unified command who is here, who's worked tirelessly to make this possible for the city to respond. But let me tell you, this is only the beginning. You heard us over a week ago announce $10 million of ARPA money going to our young people in this city who said loud and clear that it's okay not to be okay, but it's not okay when we're not connected to resources. So this city put forth $10 million, and thank you again, Councilman, for the partnership. First time ever where children in this city attending our public schools will be connected to mental health services. And then that gets us in the door to even triage and help families and that child focus on other issues that they may have going on in that household. We know that it is a direct correlation to what we're seeing on our streets, not just relative to violence, but also anxiety, depression, suicides. These things are real. And let me tell you this, as the mayor of the city of New Orleans and facing challenges in order to fix them, understand that I'm human too. My mental health is important too. And I will not make any excuses for how I take care of myself, because I matter too. We're all humans here. And we're responding to a human need and doing it in a way that is powerful. And it's through partnership. So I'm going to ask, I tell you, I don't know where I would be without this woman. We have been in the trenches through thick and thin. We've done things that people said that we couldn't do, but stayed focused, getting them done. We've made the tough decisions to keep this community safe in spite of the level of appreciation we get. But I'm hoping that the media this time, that you get it right. That when you talk about the needs of this community, you talk about the resources and the progress, real progress, that this administration, these team members are doing and providing every single day. And that also speaks to the men and women of our New Orleans Police Department who cannot do it alone. So when you think about it, when you talk about the needs of this community, talk about it in a holistic manner and uplift the men and women that we depend on every day. And in spite of how you focus on the negativity, they and we continue to show up and get the job done. Dr. Jennifer Begno.
explaining exactly what the MCIU is and really kind of going through as it was designed. But everyone should know that we started this before COVID. So we have been working on this for years, and it really was the mayor and NOPD and everyone you see behind me who have been pushing for this. There was never someone who said, we can't do this or we don't need this. So thank you so much for your leadership. So what are we announcing today? So as the mayor said, it's the New Orleans Mobile Crisis Intervention Unit, or MCIU, if you just want to be short. Until June 1st, if you or a loved one had an acute mental health crisis and you called 911, you really only had two options: EMS, if it sounded medical, or NOPD. And while our NOPD and EMS colleagues are the finest in the nation, they are not trained behavioral health interventionists. And they have limited tools available when they show up on scene. These are very complex issues, events that happen. They take a lot of time. And again, we simply did not have that level of expertise, although they did a fantastic job with what they had to work with. So the MCIU is a team of specially trained mental health professionals who will respond to calls from individuals, families, or community members who are experiencing a mental health crisis. MCIU will provide immediate assessment, intervention, and referral to appropriate services and supports. They will operate as a fourth branch of the city's first responders, along with EMS, fire, and police, to ensure a coordinated and compassionate response. And the difference is that our MCIU is not law enforcement. They are specially trained civilians who are mental health experts. This program, this team, is part of our commitment to improve the behavioral health rapid crisis response program to fill a known gap in care and reduce the stigma and discrimination associated with mental illness. We recognize through this program that mental health crises are not crimes and that people in distress need help. So what should the public expect? The MCIU will operate 24/7, and it will cover all of Orleans Parish. What happens when you call? When you call 911, dispatchers will take the initial call. I know Chief Morris, Director Morris, you're probably going to talk about this. But they'll take the call, they'll determine the appropriate responder. If it is a nonviolent behavioral health call, the 911 dispatcher will transfer the call immediately to an MCIU crisis worker. If that crisis worker then determines that a mobile unit is needed, and most of the time they will, an MCIU team will be dispatched to the scene immediately. The crisis workers will support the individual, their family, whoever their natural supports are in managing the crisis, and that's going to look different for every situation. The goal is for individuals in crisis to remain in the community, but if this is not a safe option, the MCIU team can then facilitate a smooth admission to an appropriate facility, including transportation, if the individual is willing. So what's the response time after the call is received at 911? And this is really, I think, what set this programs apart from a lot of programs that either have happened before or in other places. So again, the calls get screened by OPCD and dispatched immediately to MCIU, and then the experts on the phone will determine the severity of crisis. If they feel that they need to go out, and again, that's the majority of the time, then they'll be en route in 4 minutes or less. So how are they staffed? They're staffed in pairs of crisis workers who have a degree in social work, counseling, psychology, or other related field, and certified peer specialists. So what's really important about this is it's folks who are specially trained but who have real lived experience, and there's often no substitute for that. At our current staffing levels, there are 2 teams available during the day and 1 team overnight. And we base the staffing on looking at historically how many calls we got that we think could have fit into this definition and when they happen. So what kind of calls are they going to respond to? Again, this is nonviolent behavioral health calls. If there's any indication of violence, it's not appropriate for them to be on scene, and it's most appropriate for a law enforcement response. But there is a wide variety of situations that may fall into the category of response. So people experiencing a psychotic episode who may have a history of a mental health disorder, folks who are having thoughts of suicide, folks who have urgent needs for substance abuse treatment, exacerbations of existing mental health conditions. It's really a vast universe. And again, having cared for thousands of patients in this situation in the emergency department, I can tell you that no one is alike. What types of calls will they not respond to? As I said, scenes that are identified as being violence or a threat of violence, or medical emergencies. That's for our NOPD and our EMS folks to handle, and they'll be dispatched appropriately. So if I have a family or a loved one who is experiencing or at risk of a behavioral health crisis, can I call 911 and request help from MCIU? Yes, you can. If this is something you are experiencing, if it's something a loved one or a friend, you can call 911 requesting assistance. And again, that 911 dispatcher has really well-oiled protocols that will help determine if this is appropriate for MCIU. And if it is, they'll be dispatched. Once they're on scene, they can provide assessment, crisis intervention, supportive counseling, information and referrals to community-based mental health services, or, as I said before, if voluntary transport is needed to a higher level of care, they can provide that as well. You're going to hear from our selected contractor. We went through a really extensive process, a very public process to select this contractor. RHD, Resources for Human Development, no stranger to our community. They've been here 30 years, long time. Funded by the city, directly by the city, with oversight by the health department. A community advisory board, which is a key piece of this, and I want to shout out to our colleagues at Vera who are working with us on this, are helping us to provide critical feedback and suggestions for refinement and improvement as the program develops, and we're very, very grateful for the collaboration and expertise in everyone that we talk to. So this is early, we're 2 weeks in. There is a steep learning curve. There already has been in the first 93, 94 patients. But we really do feel that this program is poised and already making a positive difference in the lives of people suffering with mental health issues. And as you heard the mayor say, that is a lot of us. 94 times we got the call in the last 2 weeks, and that's 94 times that our police and EMS were freed up to do the things that they are trained and experts at doing. We know the need is great. And we think this is just another tool to begin to address it in a holistic patient and client-centered way. This is really out of the foundational belief of everyone behind you that everyone deserves dignity and respect and compassion when they're in crisis, and that's what we've designed this program to provide. And now, I believe Director Morris is going to explain the 911.
Thank you, Dr. Vecno. Good afternoon, everybody. Mayor, thank you for your leadership and your trust in this team to get this done. We've been working on this for a while. I want to take a moment to acknowledge the OPCD team that operationalized this experience, from the technology team, from getting all the technology units. We have outfitted the MCIU unit as if we do with any other public safety agency. So they have radios, they have mobile data terminals, and so we can also monitor their movement throughout the city. So in the event they do need help, need additional resources, we have voice and GPS location of all of our units as if we do with any other public safety agency. Also, it's important for the public to know that there is an integration with 988 as well. So we've talked about 988 being now a national mental health crisis hotline. We've already begun to receive some calls to us from 988 for this unit to be dispatched. And so a theory has turned into reality. A reminder to the residents or family members that called 911. We are using the international protocols from the International Academies of Emergency Dispatch to prioritize and triage these calls. We're not making this up in a vacuum. We're using data and science to guide our decision making and determine what calls are appropriate for MCIU. And finally, the OPCD Director of Training and Compliance is hosting a weekly calibration meeting. We review all the calls from the last week, review lessons learned so we can make operational changes as the data tells us that we should. Everyone before me has said a lot about the program. It's a great day for us. We are just the gears and the oil behind the machine, and we're happy to be a partner. And with that, the superintendent step out. Our regional director from RHD, Jan Tarantino.
Good afternoon.
Good afternoon.
Thank you. I'm representing RHD. It's a national nonprofit. We're in 16 states. However, this was the first place that we grew besides our home office. We've been here since 1997, providing crisis service. It has only prepared us for what we were chosen to do, and with that, I really thank the vision of the individuals behind me, because it's on their shoulders that we're going to be implementing and have implemented, and have a learning curve. A great model that's really going to bring caring, effective, efficient health services to individuals when a police response and EMS response is not necessary. It's the right level of care at the right time. And we're so glad the partnership. We are only one piece of this puzzle, but we are really pleased to be part of it, and we hope to do this community proud. With that, I hand it off to our boots on the ground leader, Taisha.
Good afternoon. Thank you, Mayor, Councilmember. Chief. I am the director of the Mobile Crisis Intervention Unit. As the director, we have a team of about 15 right now, and as you heard Mayor and Dr. Avigno say, we run 2 teams in the daytime and 1 team overnight. The uniqueness about this program is that we triage every call that comes in individually. We focus on person-centered care and needs. Every crisis, every mental health crisis is different, so we really try to focus on just what that individual in crisis needs. They get a fully licensed professional when they call. So when Tyrell's team transfers that call to us, you have a fully licensed person that's assessing and triage. We do utilize the dispatch first model. What does that mean? Dispatch out, assess and route. When we assess and route, we're assessing for safety, acuity, is it appropriate? But we're doing that en route so that we can get to that citizen, that loved one, in an appropriate amount of time, as quick as possible. And then once we're on scene, of course, we provide those services. We have had, in the 93, 94 calls that we have had some calls where our partners may have been on scenes and may can utilize our skills and our expertise in that subject area, and that's what we're here to do. We're here to really just address the needs in the community, meet our citizens where they are, and provide those services immediately. Try not to make them wait, reduce the level of law enforcement or other services against their will. We really try to de-escalate and reason with them to get them to go if it's needed on their own. And so, thank you for the opportunity. Look forward to working with each and every one of you.
Thank you so much. Chief Wilbur?
Good afternoon. First of all, I have to thank Mayor Cantrell, who always makes it happen. Thank you. And Dr. Avigno, who is always a champion for public safety, and anything that we can do to work together, she is always there with all her support. And I'd like to thank him for bringing this much-needed partnership together and launching this valuable program, which will contribute to the safety and well-being of the citizens of New Orleans. The New Orleans Police Department Crisis Intervention Team is a unit of officers trained in psychological techniques to engage with individuals experiencing mental health crisis. In 2022, the NOPD received and handled 5,229 calls for service related to mental health. 41% of all NOPD patrol personnel are CIT certified. The response of CIT officers has proven to be successful, with only 2% of the 2022 responses resulting in use of force. 51%, which means 2,667 of those calls, were voluntarily requested for service or resulted in a stabilization on scene. Those 51% of calls handled by NOPD could have been handled in a transitional way, and by a transitional care unit, like the mental health crisis intervention unit. With the assistance of the mental health crisis intervention unit, officers will be able to focus on other needs of the city, yet remain available to aid the MCI unit. In the event of a mental health crisis, by experiencing exercising proper training and crisis intervention techniques. In the first week of the launch, 151 calls for service for mental health services were received by OPCD. 96 of those calls for service were dispatched to NOPD and 55 to MCIU, resulting in a 36% burden reduction on NOPD platoon personnel. That is huge. It allows us to answer other calls for service. It allows us to handle those calls that are a higher priority, get to them quicker. It brings our response times down. So this is an absolute needed tool for the NOPD, and it does take a whole new meaning to burden reduction for our officers. So I am so happy that we launched this and that is getting done. On behalf of the men and women of the New Orleans Police Department, I would like to extend a thank you to all the partners, especially John Thomas, who's our Homeland Security Director, of course, our council member, who is always a champion for public safety, and he's on the Criminal Justice Committee, and although sometimes he asks the hard questions, he means well, and he wants us to win. So thank you. Tyrell Morris, of course, excellent in everything that he does and very thorough. Dr. Avegno, Mr. Salmo, everybody on our team is in on this. It's a huge win for us all over the department and throughout the public safety team. So I just want to say on behalf of the men and women of the New Orleans Police Department, thank you. It helps us to better aid and respond to our citizens who are suffering from mental illness. So this is a true gift for us. Thank you. Thank you, everybody.
Thank you, Chief. And we're going to close it out with Councilmember Oliver Thomas.
First of all, to all of the professionals here today, the city is making history. You're part of an effort that should have been done a century ago in a city without a shortage of emergency calls. This should have been done. As someone who grew up in a neighborhood where there was sometimes daily, weekly, monthly, hourly emergency calls, you could always count on someone showing up with a uniform, a badge, some handcuffs, and a gun. You know, the New Orleans Saints wear black and gold, but the angels of this unit wear green and black. And they show up with some arms, heart, and a conversation. Why is the conversation important? During Katrina, I was involved in search and rescue, where we would meet at Willow and Napoleon and launch to go out to find people who were on a list that were unaccounted for. There in your neighborhood, Sonia and Napoleon. I'll never forget the story of Tony Ledette and his mom, Miss Ledette. All of the, Dr. Avegno, all of the wildlife and fisheries and launch boats and units, they would go out to get Tony and his mom, and they would come back to Willow and Napoleon without him. And so 2 days went by that units went out to rescue them because they were on the list, they were there, but they would come back without him. So one day we were talking to the guys, because I was on another boat, guys with Tennessee and Kentucky Wildlife and Fisheries who were part of those rescue units. And we asked them, man, what happened? He said, well, every time we try to get him, it's this emotional thing, and he starts to act out, and we can't get him on a boat. So I said, well, maybe something's going wrong, right? But then I thought that I grew up in a household with my oldest sister who had cerebral palsy, who was mentally and emotionally challenged. And maybe they didn't know how to talk to Tony. So we got a boat and we went out. And because Tony reminded me of my sister, and because the most important thing Tony had was his mother, they kept trying to rescue Tony first. Tony wanted to know that his mother was safe first. So we showed Tony, hey, your mom's safe. She's getting on the boat. You can get on the boat. Tony was 6 feet, 360 pounds, right? And they didn't know how to communicate with someone who didn't need a uniform, a badge, some cuffs, and a gun. In my family, my mother taught us how to communicate with people who needed some arms, some heart, and a qualified conversation.
Thank you so much, Councilman. All right. So we have, as you see, all of our partners here from, I see Nate, Nathaniel Fields, who is our homeless director for the city of New Orleans. And I tell you, much of